Good morning, everyone. We're gonna get started. Patricia Cuff just told me that that clock is actually 5 minutes slow. So if you know Patricia well at all, you know that it drives her crazy because we're already starting late, and I wanted to make sure that we got started on time. My name is Darla Spence Coffey. I'm the president and CEO of the Council on Social Work Education, and it is my great pleasure to welcome all of you here today. My co-chair, Eric Holmboe, and I and a great team in the planning committee have really spent some good time having these conversations to deliver a program that we hope is going to be really engaging. We know that that challenge, well, we know that it is a challenge given that the topic is assessment, and assessment is clearly not as sexy as some of the other things that we've talked about in this room, but it has absolutely been a consensus growing among our forum members that it was a conversation that we needed to have, that we're not talking about innovations in health professional education just for the sake of innovation. It wasn't because we started to get bored, though it certainly has infused a lot of energy and creativity and excitement into our lives and into our conversations and into our programs. But we're needing to think about innovation because the world has changed. Our technology has changed. Our perceptions of the world have changed. Our students have changed. What folks using healthcare services are asking for have changed. And so all of these things are really driving the changes, and we need to figure out whether these changes are in fact meeting the needs, meeting the goals that we have. So we're about to start a day and a half thinking deeply about assessment. One of my favorite quotes about assessment is that it is a rich conversation about student learning informed by data. We're not going to be just talking about student learning today, but I hope very much that this is going to be a rich conversation. We've done some things differently. We've flipped the classroom. We asked you to do some things in preparation for today, and we're going to see how that goes. We've also engaged students very intentionally, and it's kind of interesting for me that we're saying health system users or healthcare users, because that's what we all are, right? But sometimes when we have our professional hat on, we forget that we also are users of healthcare. We're often on the other end, and we have opinions about how we're treated and how we're engaged and so forth. But we've got people who we've asked to sit at each table to really help us remember to think through that particular lens as we think about our topics. So I welcome you. It's very exciting to be here, and I'm going to pass things over to Eric now, who is going to do some more introductions and then get us started with our first speaker. Thank you.
Well, again, thanks to everybody for coming. We're very excited about today. As Darla said, we're going to try a bunch of different stuff over the next day and a half, and we really want your feedback on that. And we hope it'll be very interactive, and that you can leave here with something you feel you can do. One of the things that's come up in prior forums is trying to figure out ways to catalyze action after the meeting. And so we're going to try some different things we hope will help you catalyze things you want to do back at the ranch, as the saying goes. Just a real quick reminder of the objectives, because I think they're important as we set up the context for the next day and a half. We really want to look at the current state of assessment of competencies in three particular areas. That's really going to be our focus. One is interprofessional education, which has been obviously a very strong theme across these forums. Team-based care, and I'm really excited about the number of folks we have who have been thinking about interprofessional education and team-based care and what that means. And then finally, the patient-person-centeredness piece of the healthcare system. And as Darla said, we're fortunate to have students and people who've experienced the healthcare system in multiple ways to help us think through what assessment might look like for that. Obviously, there's lots of challenges around that. We're going to explore how we might address some of those challenges. And as we've talked about before, assessment is a critical component of a competency-based system. The reality is it's always been a critical component of education of any type. We just haven't done it really well. The question is, how do we do that moving forward? And obviously one of the major goals of this whole forum is to create new linkages, get us out of our silos within our own disciplines or specialties, whatever they may be. Think about how we can become much more interconnected. I think that's a very important message. And then finally, think about, again, how can we as a group move this ball forward? And so I can't think of a better person to kick us off to really begin a discussion about what our challenges are in assessment, where we might go, than John Norsini. I've had the good fortune to know John for a number of years now, and he's just done an incredible amount of wonderful work in this area and is recognized as a real leader. He's won multiple awards, too numerous to mention. But John is also now working at an institution called the Foundation for the Advancements of International Medical Education and Research. John has probably as good an international lens as anybody I've ever met, and he's really working literally across the globe to improve medical education and help people assess what those programs actually do. And so without further ado, I'm going to turn this over to John to kick us off, and then John will facilitate a conversation with the room about where do we go in assessment, what our challenges are. So John?